Now, it's Cervical Screening Awareness Week, which aims to highlight the importance of cervical cancer and why attending a screening appointment can help to prevent it. Well, here to talk more about all of that is Dr. Sara Kayat. Very good morning to you. Lovely to see you, looking lovely and sort of summery in your bright yellow.
Yeah,
lovely.
Trying to.
So, look, we're talking about cervical screening, and I was talking about this morning with some colleagues, and one of them was saying that the cervical screening process now only really tests for the human papillomavirus rather than for abnormal cells. Is that correct?
Yeah, that is true. So HPV, the human papillomavirus, causes the vast majority of cervical cancer. And so it's been found that it's more accurate, more sensitive to test for that first. If you have the high-risk HPV virus, then you'll be tested for changing in cells. But if you don't have that virus, then that ongoing test does not need to be done.
So how often should women be getting screened and at what sort of ages and what's the highest risk bracket?
So the test is for between the ages of 25 to 64. Between the 25 and 49 bracket, it's tested every 3 years, and thereafter it's every 5 years. So it's that high risk bracket that's tested 3 yearly.
And are people taking up the offer that they're getting from their GPs to come for it in general, or are a lot of people dodging them?
Well, this is what's actually really devastating to hear as a doctor, because 1 in 3 people are not taking up the offer. And we know that cervical cancer is one of the most preventable ones we have. 70% of cervical cancers can be prevented by having the screening. And if you attend regularly, it's estimated that 83% of them can be prevented.
Are there any factors that would make you higher risk or lower risk of contracting this cancer?
Well, we know that those that carry HPV are at the higher risk groups, and there are some people that are at higher risk of getting HPV. So if you started having sex at an earlier age, then that potentially can increase your risk.
And what about those people who just think the whole process is really invasive and unpleasant and that just find it back? I mean, every 3 years is an awful long time to keep going back and having to have this sort of examination, and a lot of people complain it's uncomfortable as well.
The most commonly cited reason for people not having the HPV, not having the cervical screening, is because of embarrassment. And I think that's so upsetting, because actually, as a healthcare professional, we're there to try and put people at ease. So I really want to implore that anybody who does feel embarrassed or worried about it, please speak to your nurse or the doctor, or whoever it is that's doing it for you first, to try and put you at ease. In terms of it being painful, there are some people that do find it painful. It's not meant to be a painful procedure. Is supposed to be, potentially uncomfortable. But if it is painful, then it could be for certain reasons. Maybe you need to be given certain lubrications or estrogen gels beforehand, perhaps even listening to music, or, do something like meditation beforehand to try and help.
And what about the symptoms of cervical cancer? I mean, if people have skipped their invitation for a screening and they're not quite feeling themselves, what might be some alarm bells from your point of view?
So we know that some of the symptoms can be bleeding in between your periods, bleeding after sex. Those are probably the most common of the symptoms. But I would say that if you have missed your screening, you don't have to wait for 3 years' time. Just contact your GP surgery and they can book it in for you.
OK, good advice. And I suppose, look, it's always in the back of everybody's minds when we talk about this is Jade Goody and, how tragic that was. She left behind 2 boys. It's just, a tragic story, but a good reminder of what can happen if you don't look after this part of your health.
Cervical screening saves lives.
Fantastic. Dr. Sara, thank you very much.
Thank you.